how to best remove a tooth, watch this video until the end to find out how to restore the tooth right after extraction. A very common question, or rather very common cases in my practice, is when patients come in to have a tooth removed. Of course, we often talk about scheduled tooth extraction, or what is called planned extraction, when a tooth isn't causing any issues but has long been due for removal, or sometimes even just the remnants of a tooth. That's why on the patient, as they say, I would like to say that, so that the patient is not just, that is, in modern realities, there is such a technology. It is called one-stage implantation. And unfortunately, not all patients know this, even if they haven't heard it completely, understand what it is, and even if they understand, for some reason they don't apply it to regular planned tooth extraction when it's really necessary to simply extract a tooth, I emphasize. Not in case of acute pain, absolutely not. That is, in case of acute pain, we extract there. There is no other option. If we extract teeth on a planned basis, that is, the so-called one-stage implantation. What is the essence of immediate implantation? So, the patient comes in for a scheduled tooth extraction, whether it's the tooth itself, its remnants, or even just the roots. And right after the extraction, the doctor immediately places the implant. Of course, it can sometimes seem a bit costly. That is, in terms of money, in terms of the economy, in terms of the budget, of course. But it's better to do it right away and forget about it, and only because in 3 months or 6 months at the most. In that spot, a ready-made tooth will appear, but patients often think, no, I'll just have it removed now and later I'll come back and think about it. And that's where they end up delaying themselves. The most important thing, and I want to emphasize this, is the beauty of immediate implantation. You'll spend just 15 minutes in the dentist's chair. The actual tooth extraction will only take an extra 5 minutes at most, but you'll already have the implant in place because the anesthesia will be administered. So the doctor will do everything under one anesthesia. The doctor will administer the anesthesia, and in any case, he will remove the tooth for you, but he will also place the implant right away. In this same socket, sometimes the implant is placed right away, sometimes it gets a little cleaned up, but fundamentally, that doesn't change the essence of it. But the main goal is to place the implant right away. And this is what I would like to say or convey, at least so that you are armed with this information, understand what it is, and if you are still planning to remove teeth. I'm emphasizing scheduled extraction, meaning we never want to be in a situation where we have a swollen cheek when everything is inflamed and the tooth hurts. No. In such a clinical case, or with such a diagnosis, immediate implantation cannot be done. This is most often the case for planned extractions. When patients usually come to the doctor for a checkup, the doctor marks which tooth needs to be extracted and which one needs treatment. So if you've planned a scheduled extraction of a tooth that isn't bothering you, it's time to go ahead with that removal. Get ready, gather all your strength, muster your courage, and think about immediate implantation. Right now, most clinics that offer implantation provide this service, so go for it all at once. As they say, the doctor can calmly extract the tooth and just as calmly place the implants in one go. You won't notice anything, and I emphasize that the procedure itself will only take an extra 5 minutes. But you'll leave with an artificial root, and in 3 to 6 months, they'll place your complete, beautiful new tooth there. So, this is precisely to me that, let's say, main, I wouldn't call it a problem, but rather something like that. So, when a patient comes in and talks, especially those who have already had a tooth removed, yes, unfortunately, we can only do that after the extraction. So, if we remove a tooth and don't place an implant, we can only do that no earlier than 3, sometimes 6 months later. You see, yes, if we remove the tooth and leave without placing an implant, then coming back after 6 months is also an option. But I say again, to avoid coming back for a second visit, because for most people this is often a stressful experience. So, this visit to the dentist is still a surgical intervention, so it's better to do it all at once. Come in once, have the tooth removed, and the doctor will immediately place the implant for you, and then you'll be sent on your way calmly. The main advantages of this technology, that is the primary advantage, especially if it's the tooth we plan to extract, it is in the smile line or in the smile zone or in the visible area. When the patient smiles, we can immediately place a temporary crown for you, literally the next day. This is also a huge plus, meaning that there are patients who come to us in the tooth that is planned for extraction. It is in the visibility zone. It is either central, that is, it is visible, and the patient thinks for a long time, is afraid, does not know. Otherwise, I'll remove it. What will I do then? How long will I walk around without a tooth? So they don't understand and they think, are they going to put in an implant? And do I have to wait another 6 months? So I'll be walking around without a tooth, but with some artificial root that no one can see, waiting for it to integrate and only then getting the crown. No. Now, dentistry is real. Technology allows us to actually put a temporary tooth in your mouth the next day on that implant. So the first thing we achieve is, of course, to restore the teeth almost immediately. This is the first thing. Secondly, of course, we avoid those very problems that most often affect patients who have their teeth extracted. And, of course, they will just keep putting it off for a long time. In practice, this has been tested, and unfortunately, there are not many patients created who are still teeth. It's one of those things that if it doesn't bother you, of course, our mentality is such that we won't seek help, and the patient often forgets. And that's exactly how we end up with those very problems that I want to talk about now. The second downside, or rather the upside, is that we don't lose that bone. We don't have tooth shifting, and we don't have the opposing tooth moving forward. So all the same problems that arise from the absence of a tooth. So they most often arise. The patient removes it and puts it off for a long time. It all lasts until better times. And by the time they come in, unfortunately, it's already completely too late. Other methods are required, additional methods that will somehow allow us to replace it. It's just this one tooth. So if you have this kind of clinical situation, it doesn't matter where you are, in which city, just come in, call your clinics and find those clinics. So right away, if you've decided on a clinic to go to for a tooth extraction, make sure to check with them if they offer implants. If there is one, agree to it right away. Let the doctor know right away. Ask them if they do implants. I want to have it removed and have the implant placed immediately. Just say this directly to your doctor. You can do this right at the stage of the phone call, right over the phone. The administrators are usually very knowledgeable in a dental clinic, meaning they have a lot of experience, so they will consult you right away and say, yes, we have that method, come on in. So if you've planned to have a tooth extracted, please consider the option of immediate implantation. Well, at the very least, don't neglect it, and let's say don't forget about it. Weigh your options, of course. The decision is ultimately yours, but definitely think about it. Remember and apply this. Write in the comments how much you knew about this method or this technology, or about the possibility in dentistry to have an implant placed immediately after extraction. Send a WhatsApp message using the link below, visit our website, like our posts, and subscribe to our channel. Take care of yourself.